Good evening. Welcome to this episode of the Paediatric Voice on this 21st day of February 2024. I'm your host, Dr. Helen Namsoke. Thank you for keeping it at Bethany TV for health and for enjoying the various educational and life-inspiring stories and programs that have helped grow your health and make you a productive individual. Well, many of you have seen a child or have heard of a child or an individual with abnormal body movements. Sometimes these happen during sleep. They may happen when the child is playing and going around with their day-to-day activities. Sometimes they can happen while they are, just seated. These may involve the entire body or parts of the body. But the question is, are all abnormal body movements convulsions? Very often in our day-to-day clinical care, we see parents record some of these videos, and most of them are of concern to you. Are they normal? Are they abnormal body movements? And so much more. Well, today on the Pediatric Voice, we are going to discuss epilepsy in children. And in this topic, we are going to look at what are abnormal and what are normal body movements in children. And what exactly is epilepsy? What can be done? What are the advances in epilepsy care in Uganda and the world at large? Well, yesterday, Uganda celebrated the International Epilepsy Day, and the celebrations happened in Mulago Hospital, and they discussed neurosurgery as part of the treatment measures for treating children living with epilepsy. On this show, we shall still delve a little bit into neurosurgery as treatment for epilepsy. Does it help? And who can go for it? Welcome to the Pediatric Voice. I'm your host, Dr. Helen Namsoke, and we are having Dr. Robert Sebunya. But first, let's have his profile.
Francis Hospital in Zambia. He trained at Dr. Sebunya Robert Kabuye, pediatrician and pediatric neurologist at St. Francis Hospital in Zambia. He trained at Mbara University of Science and Technology, Makerere University, Red Cross Children's War Memorial Health South Africa, and University of Cape Town, South Africa. He has an 11-year experience in childcare and is passionate about taking care of children living with neurological conditions. He is an honorary lecturer at Mother Kevin Postgraduate Medical School, Uganda Matters University in Nkozi, as well as Makerere University College of Health Sciences. He is a winner of several accolades, that is, the Sheila Wallace Award 2024, the prestigious D'Souza Barnard 2021 Fellowship Award, the current Young African Child Neurology Society representative to the International Collaborative Body, the Pan-African Epilepsy Training 2021 Ugandan Faculty of June 2021. He is a mentor in pediatric neurology care as well as a facilitator for the Pediatric Epilepsy Training.
Welcome to the Pediatric Voice, Dr. Sebunya.
Thank you very much, Helen. Thank you for hosting me. Good evening, viewers.
Thank you. Yes, as you're well aware that we, every second Monday or somewhere in February, celebrate the International Epilepsy Day. And I saw you very well discussing something very interesting yesterday about neurosurgery. So our viewers out there are eager to learn more about surgery as part of the treatment modalities in children living with epilepsy. So we would want to learn who would benefit from it and does it actually help, and so much more tonight.
Well, thank you very much.
But before we delve into the discussion, let's first have a documentary on epilepsy.
Epilepsy is a chronic non-communicable disease of the brain that affects around 50 million people worldwide. It is characterized by recurrent seizures, which are brief episodes of involuntary movement that may involve a part of the body or the entire body and are sometimes accompanied by loss of consciousness and control of bowel or bladder function. Seizure episodes are a result of excessive electrical discharges in a group of brain cells. Different parts of the brain can be the site of such discharges. Seizures can vary from the briefest lapses of attention or muscle jerks to severe and prolonged convulsions. Seizures can also vary in frequency from less than one per year to several per day. One seizure does not signify epilepsy. Up to 10% of people worldwide have one seizure during their lifetime. Epilepsy is defined as having 2 or more unprovoked seizures. Epilepsy is one of the world's oldest recognized conditions, with written records dating back to 4000 BC. Fear, misunderstanding, discrimination, and social stigma have surrounded epilepsy for centuries. This stigma continues in many countries today and can impact the quality of life for people with the disease and their families.
Epilepsy is associated with a lot of discrimination and social, issues. And in some countries, you cannot actually qualify for some professions. For example, you cannot be a surgeon. You cannot be an official driver. I don't think you can be allowed to fly an aircraft if you have a diagnosis of epilepsy on your record. What do you have to say about that?
I think epilepsy has, from the preamble, from what we've gotten, it's a neurological disorder and it's a very common neurological problem. However, that one does not prevent people from fulfilling their potential. When you manage it rightly, many people have gone on to become doctors, to become surgeons, whatever specialists they are, when they have lived that condition, provided they have controlled the seizures. So it's not true that you are not supposed to become a doctor. You can't become a surgeon because you are epileptic. That is not true. You can, if you control the seizures, you can fulfill your lifetime potential.
That is very, very fulfilling. I'm very sure parents out there have been having questions, and I think that's why some parents run away from such diagnosis, because they are associated with discrimination. But dear viewers, you've heard it from the neurologist. Dr. Sebunya is a pediatric neurologist, that if seizures are well controlled, you can grow to your full potential and, do whatever you think about with very good seizure control. But Dr. Sebunya, before we go ahead to control our seizures, first of all, what is a seizure?
Well, you could say a seizure is a transient occurrence of signs and symptoms due to a hypersynchronous neuronal discharge. Or
let's go slowly.
So you could say a seizure, in brief, that it is occurrence of signs and symptoms. And what are signs and symptoms? Could be behavioral problems, could be jerking, could be just daydreaming or behavioral arrest. And when that happens, if it happens and it is due to a disorder because of electrical mechanisms that are supposed to control the electrical impulse in the brain, then that is a seizure.
So in other words, there is either an arrest in someone's behavior,
yes,
or an abnormal behavior, or an abnormal body movement,
yes,
and this is caused by an abnormal activity in the brain.
True.
So in other words, there is a known activity a brain should follow.
Yes.
So if it is deterred, then we are likely to have something happen. And that is what we call a seizure.
A seizure.
Good. And what is epilepsy?
Then epilepsy, and those are very two good questions, and I want the viewers to know this, that when you have a seizure doesn't equal that to having epilepsy. Epilepsy is the propensity to have recurrent seizures. So if one has been having the seizures we've talked about, epileptic seizures we've talked about, and they occur recurrently. That one now is called epilepsy.
Now, there are two things here. I saw from the statistics about 10% of the world population has suffered at least a seizure in their lifetime. And yet the prevalence of epilepsy is about 0.6%. 0.6% in children, actually. So that means not everyone who has had a seizure has suffered epilepsy, right?
Right.
Very good. But very often we get children coming into the clinics with abnormal body movements, and the parents are very good. They usually record them. So the question is, are all abnormal body movements seizures?
The answer is no. Not all abnormal body movements are seizures. Many abnormal movements may want to resemble seizures, or what you call mimic, but in the simplest language you could say resemble seizures. Not every person who falls down and starts to jerk has seizures or has epilepsy. There could be seizures, but when they are not epileptic seizures.
You're confusing us.
They could be seizures, but when they are not epileptic seizures.
A seizure, dear viewer, is okwesika, komubiri, convulsions. Repeat your statement, Dr. Sebunya.
What I was saying is that not every person, for example, who falls down and starts to shake, to jerk, is having an epileptic seizure. And so is that not every person who will go down and starts to jerk is having epilepsy.
Okay.
Yes.
Because very often, children, there are those that get to jerk with a high temperature, others jerk for no known reason. And, so many times the parents are worried, and the next question we face is my child epileptic?
Yeah. So I'm often that I also come across such questions. Being a neurologist, I get a lot of that and a lot of abnormal movements. What I tell the parents or the mothers who come by is that please record for me a video so that I can look at it, so that I reassure them. For example, you do have movements where a child is sleeping, and before he's getting to sleep, he starts to get jerking of one hand or both hands or one side of the body, but he doesn't wake up. So and it only happens when he's going to sleep or when he's asleep, which you could be calling a benign sleep seizure or benign sleep myoclonus. But with a parent, it will worry them a lot, which is understandably so that they have to get worried. So basically, to answer you is that not every jerking is a seizure. And when the parents come to you, it's important to allay their anxiety and look at what they are presenting to you. So I want viewers out there that whenever they get an abnormal movement, if they have phones now, these smartphones, they get hold or they take a video of that movement, so that when it comes to a one Dr. Namsoke or Dr. Sebunya, he shows them the video, she or he is able to judge and say, okay, this is either a seizure or this is an abnormal movement. Yes. Okay,
that is very interesting. Dear viewers, it goes back to you. Make use of that smartphone. As he earlier said, that very good epilepsy control is likely to help your child grow to their full potential, for their full productivity. In other words, it is very important to diagnose a child with epilepsy. But however, you as an individual, as a guardian, as a parent, you may not know what exactly is epilepsy or not. And it is very important not to overdiagnose epilepsy or underdiagnose epilepsy. And how can we be helped? By seeking care of a health worker. In other words, whenever you have your child having an abnormal body movement, take a video of it as evidence and then go seek care in the nearby health facility. Show it to the health worker. They'll look at it and then tease for you whether what you're having recorded is normal or abnormal, and what can be done. What really causes these abnormal body movements?
So the cause of these abnormal movements, if they are, since we're talking about epilepsy, is there is more of the abnormality in the electrical discharge from the brain. So,
amasanyalaze.
If the masanyalaze or the electrical discharge from the brain is abnormally or diverting or going away from the normal, then you may end up having these abnormal movements.
Maybe to enlighten dear viewers, the brain is like your solido, your controller. So it is the one that controls all the body activities. So it has wires, what we call nerves, and these transfer electricity throughout the body. So, and that is what controls the different activities you do within the body. So, isn't it, Dr. Sebu?
Yes, you spot on. Our brain is full of billions of cells, and these cells help they communicate with each other. That's why when one taps you here, you can still feel that somebody has tapped me this end. The brain is full of networks that connect to each other. They are cells. They are like wirings that are connected to each other. Yes.
Okay. So you are saying the causes of abnormal body movements if you have an interruption in the wiring somewhere.
Yes, that is one. Then the other causes of abnormal movements could be if you got problems that control the part of the brain that also coordinates movement. For example, there is a part of the brain that, for viewers, the part of the brain that controls us, for example, how I put this hand this way, or where I can
whether
take
I should lift my leg or not.
Yes, where I should lift my leg. That part of the brain, we usually call it the basal ganglia. So if it is affected in one way or another, you could also have abnormal what?
Body movements.
Body movements. So though we are talking in adults, they may end up having Parkinsonism if that area is affected. So you could have abnormal body movements. Yes. So basically, if the electricity of the brain is abnormally being discharged in the brain, you could still have the abnormal movements that will become epileptic seizures, or it may not be epileptic seizures, but the area of the brain that is responsible for controlling movements, if it's also affected, you could have abnormal movements, but those ones are not epileptic what? Seizures.
So what are the risk factors to getting epilepsy?
Thank you very much, Helen. So the risk factors and for getting epilepsy, being a pediatrician, I'll go straight to my field. But in general, we have about, in our setting here, the risk factors could go into about 6, but one, I'll go commonly in what we find in our environment, could be inherited or genetic, whereby the epilepsy runs in families. However, being genetic doesn't mean that the mother or the father must be epileptic. No. This could just, when the child who they have is the one that has become epileptic, which we can call in science a de novo mutation, that it has just occurred in this child. It is a new
occurrence. A new occurrence.
But it's also genetic. So
in others, the rest of the family members have the gene,
yes,
the blueprint for epilepsy.
Yes, actually some could have the blueprint, some even may not have when we are talking about de novo, and it just happens in this one.
So does that mean the generations after this child may develop symptoms?
Yes, if where the problem is what we call autosomal dominant, we have epilepsy genes now that are autosomal dominant, then the generations that follow may have epilepsy. But that is one in the 6. The other causes that are very common in our setting is infection. Infections that go and affect the brain. And in children, for example, you could have cerebral malaria. You could have viral encephalitis. You could have bacterial meningitis. People who eat, for example, adults who eat, for example, half-cooked pork. That cyst, if it goes to the brain, can also give you seizures. So basically infections. That's why those are infections among some of the methods that you can use to control epilepsy. If you treat malaria using a mosquito net, going for vaccination to control some of the viral infections like measles. We've just heard on the TV that we are having an outbreak of measles. And as me, a neurologist, I get worried. And I say, oh, the brains might be affected. So those are only two. So we've talked about the genetic, then we've talked about the infections. Then the other causes could be structural brain abnormalities, that the brain never forms very well. Could have abnormalities that occur when the brain is being formed. The brain passes through a lot of processes when it's being formed. When the baby is born, we are all very happy that we have a good baby.
A new baby, every family would, smile.
Yes, but the processes that the baby has undergone through to have this very good bouncing baby boy or girl are very complicated. Some of them may not occur very well. And when they don't occur, you might have disorders of the development of the brain. And as such, you could have seizures coming through as a result of a disorder of brain development, which could result into structural brain abnormalities. Those are about 3 of them. The rest are metabolic, but it's not very common in our setting. Usually we drill on infection. In a study that was done by Professor Angelina Kakoza and her colleagues, actually realized that most of our epilepsies are infection or structure-based, that there is something that is causing it.
Okay.
Difficult deliveries are a problem. Traumatic, if you have border men and they hit our brains, if you get an accident and you get a traumatic brain injury, then your chances when you heal, if you recover, if the brain is affected, you might end up having epilepsy.
That is very, very educative, Dr. Sebunya. Dear viewers, you've heard it very well. Very often they tell you to sleep under a mosquito net and have proper diagnosis of malaria so that you get it treated very well. You can see it is just not having vomiting, a fever. It can escalate into cerebral malaria, and this can predispose your child to epilepsy. That is it we had with the risk factors of epilepsy. But first, let's have a break.
Bethany TV for health. Are you ready for this good news? You can now watch Bethany TV on your TV, AfroMobile, and Airtel TV apps. Yes! Catch the finest programming prescription for everybody, wherever you are, whenever you are. Bethany TV for health. Are you looking for a platform to advertise your business and boost your sales? Bethany TV got you covered. Take advantage of our introductory rates and maximize your leverage for brand awareness, advertising, product launching, live coverages, activations, and so much more. For booking and more information, contact our sales team on 0785 576 269. Bethany TV for health. Exciting news for all viewers of Bethany TV. Bethany TV, the premier health TV channel in Uganda and Africa, and also your favorite TV station, is now on Star Times. You can now watch Bethany TV day and night, weekdays and weekends on Star Times, channel 271. Catch your favorite programs on health, wellness, entertainment, and so much more. Bethany TV is also available on free-to-air, GoTV, YoTV, Airtel TV, and Afro mobile apps. Not forgetting online via our website www.bethanytv.ug and social media platforms at Bethany TV UG. Bethany TV for health. Showing on Bethany TV.
Life is a juggling act, with the demands of life posing the need to look glam and rise to the occasion. But amidst all this, there are things that cannot be compromised, like how we care for our skin, tend to our scalps, revitalize our looks, and rock the ever-changing apparel dynamics.
Join me, your host, R. Sima, every Sunday at 3 p.m. on Skincare and Beauty as we understand in depth how to care for our skin and look glam in a healthy way.
Bethany TV for health.
Welcome back from the break, and thank you for keeping it at Bethany TV for Health. Well, you can watch us live on GoTV, that is channel 841, channel 271 on StarTimes, and channel 170 on free-to-air. Feel free to share, subscribe as you watch on YouTube. Call in your friends to watch us on Facebook and Expresses, that is Bethany TV Uganda. And in case you miss the different shows, feel free to check us out as Bethany TV Uganda on our different social media platforms. This is the Pediatric Voice, and I'm your host, Dr. Helen Namsoke. And today we are discussing epilepsy in children with our guest, Dr. Seizures Robert, who is a pediatric neurologist at Nsambya Hospital. He is very passionate about epilepsy care in children. So, Dr. Seizures, having seen seizures, it is very frightening to see a convulsing child. True. And we often, it sends us into a panic attack. And surprisingly, not only at home, even in the facilities, just health workers seeing a seizing child. Maybe our viewers out there would want to understand how, just a brief description of a seizure. What exactly happens?
Oh, okay. Thank you so much. So, viewers out there, a seizure will depend on the part of the brain where the problem is. And let's all recall that the brain has many different functions. You have, for example, the back part of our brain, our head, that is usually called the occipital lobe. It's for vision. Though our eyes are here, but we see from this end.
From the behind.
From the behind.
Yes.
This front is, we could use it for movement, the motor and everything. So if the problem is occurring from the different parts of the brain, the seizures may manifest depending on where the problem is coming. What?
Coming from.
Coming from. The commonly seizures actually will manifest with jerking of the body. But that's only one kind of seizure manifestation. You could have seizures just happening where somebody is as if he's daydreaming. He's just looking in one spot like this. Some can just have small jerks. Others could even have signs and symptoms and say, I feel like vomiting. I feel very weak. Then he sleeps off. That could be a seizure. What I want this public to know out there is that seizures do not necessarily mean that we are only going to do what?
To convulse, to jerk.
To jerk the body. There are others who could have absences. He's just there and is absent for a while, And actually, in class, if it's a child in class, even the teachers may reprimand them or beat them up and say, "Is dead."
He's always absent-minded.
He's always absent-minded.
What are you thinking about?
What are you thinking about? When actually the poor girl or boy is having seizures. Because people know, or the populace know, that seizures are supposed to do what? To jerk. Jerking is one form of a seizure manifestation. We could have many other forms depending on the part of the brain which is affected.
Now, some of us were brought up by disciplinarian parents.
Yes.
And they could easily tell you, stop doing that, stop that habit. I don't want to ever see you do that. Does a child have a control of these activities that happen during the seizure episode? Can they stop them?
Actually, they are unable to stop them. Even if they are aware. There are some seizures that occur and somebody is aware. You can see him or her jerking, say the hand, and he sees it jerking, but he can't stop it.
Even when you tell them, stop moving that hand?
They can't. When it's a seizure happening, epileptic seizure happening, and he says, I'm seeing it, it's jerking. If you do not know, you may say, this is not a seizure. We know a seizure, somebody has to jerk the body, then he gets foam from the mouth, or he starts to drool.
Or they urinate
on themselves, or eventually even their bowel loosen up and they can sort of defecate. But that is only one presentation. So I want our viewers out there to know that seizures do not necessarily mean that you're only going to do what? To jerk. They can manifest in many different forms.
Okay, very, very interesting. So, Dr. Sebunya, with this epilepsy care, where can someone seek care?
So, usually, with the reason why we come here and also to highlight where we can seek care, in many different health facilities, we have trained health workers in the management of epilepsy. The Ministry of Health has set out mental health facilities,
units at almost all district
regional
hospitals and
district referral hospitals that help to manage epilepsy. And we encourage them to continue managing the epilepsy. If whenever you have more than the patient's seizures are not being controlled, and you reach a point of adding on another drug, then you need to refer that patient to see ideally a specialist in epilepsy. And that specialist in epilepsy could be Dr. Namsoke, could be me, could be any pediatrician
who's trained in
epilepsy care. It may not necessarily be a neurologist. Neurologists, we have two of them in Mulago. That's Dr. Angelina Kakoza and Dr. Idro. I'm in Nsambya. And we have also Dr. Justus Byarugaba and Mugovic doing his clinic. So as we realize, the numbers we are 4. So it means that we can't handle all. So what we are doing is also to train and empower other people so that they can do that. That's why I said any person who's trained in the care of epilepsy. And the last I checked, Dr. Namsoke Helen is trained in the care and management of children with epilepsy. So, viewers out there, you need to go, whenever a child has a seizure, we encourage you to come to the health workers. Then, if the seizures fail to be controlled, then they can always refer to some of the specialists who are trained in the management of epilepsy.
Yes, so very often these seizures may happen when the children are playing about. They are, for example, at school or at home. It's very rare that they happen actually in the facility. What can the teachers or parents do to make sure that things don't go berserk? Just imagine your child who has been well playing about, who has been seated eating their own food, and then all of a sudden they start, getting abnormal movements. What can be done at home?
So at home or wherever a seizure will be occurring, we encourage people not to just run away. They should help this child. If he's seizing, you put them on their left area or their left side, which is usually a recovery position. Remove away all the sharp things or anything that could harm this child when he's seizing. It is not helpful to start putting one's fingers into the mouth, saying that this is going to happen. Actually, the child could bite you because these are abnormal movements. You don't have control over them. If the jaw is having out of spasms and the child is, for example, having twitching and spasms of the jaw and is shaking everywhere, then they can potentially actually bite you. So it is incumbent to you to put this seizing child in a flat position, remove all sharp objects, and actually even call in an ambulance or call in, if the seizures take more than 5 minutes, you have to be calling in an ambulance to help.
So you mean
the
they
child.
can last less than 5 minutes?
Actually, most of the seizures usually last less than 5 minutes. Yeah.
Okay.
So a few will go on to more than 5 minutes.
You talked about putting fingers in the mouth.
Yes.
Very often the public out there is worried about the biting of the tongue. And sometimes they bring the onion, sometimes they bring the spoon. Does it help?
It doesn't help. Bringing an onion when the child is convulsing and is unconscious is just stimulating the nerves. We call it the nerve number 1, cranial nerve number 1. That is responsible for smelling. So when you put it there, because the onion is smelling a lot, it will sort of the smell of the onion will stimulate that nerve, and somebody will wake up, and you think that is the onion that has made them wake up. Instead of running to get the onion when the child is convulsing, it's better you put this baby in the left lateral position, remove all sharp objects, and if the seizing takes more than, or convulsion takes more than 5 minutes, then you need to intervene. And that's why even in our recommendation, we say if it's the first and it has not taken more than 5 minutes, because we said not all of them will take more than 5 minutes. Yes. So the onion doesn't help.
And a spoon?
And neither the spoon does any help.
Okay, very interesting. So having had my child who has chronically lived with epilepsy, and maybe they've been on medication, when should I say, I now need to go and visit a clinic?
So every child who has been on, we anticipate, or most of the time, we expect that any person who's on anti-seizure medications we think 70% of them should be controlled on anti-seizure medication. And that is what we know. That 70 to actually even can go to 80%, but mostly 70% of people who have epilepsy, when you give them their anti-seizure medication, they will get controlled. So whenever you don't get control, then there are some things that may not have been properly done. And that's why viewers out there should know that not every person who has seizures and has epilepsy must also start anticonvulsants or anti-seizure medication. You should discuss with the caretaker and tell them, yes, now we have confirmed that this child has been having a propensity to recurrent seizures. We've now confirmed with even a good investigation like an EEG that your child has epilepsy. I know when you tell a mother or any caregiver that you have epilepsy, you've taken them off. They said, oh, what has happened to me? Epilepsy seizures can be controlled. And after 2 years, if you take the drugs very well, which we usually tell the minimum 2 to 3 or 4 years without seizures, this is epilepsy resolved. We call it epilepsy resolved. All seizures have been controlled. And even we can take people off anti-seizure medication. Yes. So every person, to answer the question, who has had seizures, ideally should see a doctor or a health worker trained in the management
of epilepsy. So you've talked of an interesting group that have had epilepsy resolved or seizure controlled, but sometimes we see some of them, after a while,
they are still
they get, a conversion. What would cause it?
So there are many causes. If somebody, especially if somebody has been controlled, if they've been controlled and suddenly they get a seizure, then there are other things. Are they taking their drugs very well? At times you could have a child who has been, or even an adult who has been taking their drugs very well, controlled, then they go into relaxation mode and stop taking the drugs.
It's not easy to take a pill
I know,
every day.
and that's one of the things that you want to tell somebody, that I know this is a journey that we are starting. It may not be very easy, but please do this. At least if you get controlled for the next 2 years without seizures, we have chances of stopping this anti-seizure medication. In my practice, I've had many people have stopped anti-seizure medication and they are living seizure-free. They're doing very well. Yet they came thinking, when I told them that the diagnosis is epilepsy, they thought that this can never be controlled. You are going to be, they have a lot of this, are going to be on drugs for the rest of your life.
For the rest of their life. So dear viewers, it is very good to stop epilepsy treatment or anticonvulsants, but with the help of a health worker, not on your own, because they need to tease out whether you are responding very well on the medication or not. Otherwise, if you stop on your own, you're likely to have worse seizures than you had before.
And what I wanted to say, just to answer your question, is that somebody has been controlled, then the seizures come through. One of the things could be that adherence problem. In children usually grow with their drugs. When we say a child, dear viewers, a child is not an adult. That's why pediatric epilepsy management is very different from adult epilepsy management. Children grow with their drugs. When their weight increases,
even the dose of the drug changes.
Then the drug dose changes. I want viewers out there to understand this, that when you come to a Dr. Namsoke or me and I start treatment and the seizures go away, please don't stay and lay
at
back
home for 3 years.
And say, the doctor told me that after 2 years
they will stop.
So you start continuing to buy drugs. You may give the drug, and after 6, I've had many call me, doctor, this thing had gone, now it has come back in.
Because now the dose is not adequate.
Dose is low, it's not adequate enough to control the seizures. So apart from, they could be taking the drugs very well, but the dosing is not adequate. That's why it's good to go to the health worker, especially pediatric epilepsy, and say, doctor, is this dose okay for my child? Okay? That is very, very important. Yes, especially when you have been controlled, the adherence, the dosing, even some side effects. There are some who take the drugs. There are some drugs that may cause one to gain weight. Those are the comorbidities, or what we call side effects. And the health worker you should always ask the doctor when you're starting the drug, what are the potential problems or side effects of this drug? So that they don't prevent you from taking the drug and you take it episodically. Okay? Drugs that cause weight gain, that causes weight loss, that can cause problems, cognitive problems, the child's behavior is a problem. This could deter the parents, especially children, from giving the drug.
Very interesting. Are there new treatment modalities that are helpful, apart from just giving drugs?
Yes. There are many. We have the commonest, I want to tell viewers out there, is the antiepileptic drugs. But we have other modalities of management of epilepsy. One could be epilepsy surgery. The other ones could be diets that we call ketogenic diet, which is a diet that has a lot of fat. But that one should be done by a dietitian. The other ones could be what we call, their form of surgery, but we call them neuromodulation methods, like vagus nerve stimulation, deep brain stimulation, and those other modalities of management of epilepsy are used also in adults management, for example, of other movement disorders. But the commonest that we do in our setting, especially in drug-resistant epilepsies, is epilepsy surgery. But not every person goes for epilepsy surgery. We usually assess the suitability for epilepsy surgery So some of the assessments that we do, we see this person, we start somebody on the drugs. If he takes 2 drugs and the drugs are not working, and we investigate and we see that there is something in the brain where the seizures, that is potentially giving us the seizures. And that thing is a structural problem. And it's also correlating with the seizures, and somebody has taken drugs and are not working, then maybe that person could be an epilepsy candidate. And that's what we've done. Yesterday, some of our colleagues in Mbale, through our collaboration with myself, Dr. Richard Idro, Emmanuel, and also some team from the US, we've been having these meetings and having people who are suitable for epilepsy surgery, and we have been trying to help them out. And so far, so good. The few who we have done, because we are just in the early phases, are doing well, and some even have taken off anti-seizure medication. We started them on treatment, the drugs were not working. We realized that the problem is in the brain. In the brain, it is a structural problem. It was correlating with the seizures. We said, let's go and remove this thing from the brain and we see if the seizure stopped. And when we removed it, the seizure stopped. And that is the science or the genesis of more of epilepsy surgery.
Very interesting. Dear viewers, I know very many of you might get excited with this surgery business. It is very unpleasant to see your child convulse, and I know very many would want to go for surgery, and as you've heard from the experts, not everyone can benefit from the surgery, so feel free to visit the health workers, let them tease for you whether you would benefit from the surgery or not. Dr. Sebunya, what are the don't do's in the epilepsy care?
So the don'ts in epilepsy care could be many, but like I told you, in epilepsy care, you want somebody to fulfill their potential. So abrupt cessation because the commonest, the first that we do in epilepsy care is giving anti-seizure medication. So abrupt cessation of anti-seizure medication. You say, I've improved, then you stop.
I'm tired. The side effects are too many.
Yes, then you stop. I think it's good that you talk to the health worker. So that is a big don't. Don't abruptly stop the drugs. Don't start also, the drugs start small and build it up gradually. Then if you have, for example, if it is me who has epilepsy, we have different types of epilepsy. We never discussed it. What I have may be very different from what.
So I cannot take your pills?
Yes, you cannot take my pills. So viewers out there, if I'm taking pills that are used to manage for management of epilepsy, mine that I'm taking may be very different from yours. So if you say, and you say, oh, even my child was having these falls.
Even the other auntie's child had the same issue.
So you used these drugs, go and buy these and take that. That is not recommended. That's a don't. You need to have a health work to tell you, because different types of epilepsies and seizures respond to different types of anti-seizure medication. So that is also a big don't. Don't run away from these people. Stigma. Epilepsy is not contagious. I want to tell viewers out there that epilepsy is not contagious. If I have epilepsy, Helen, when you are seated like we are seated next to me, or even my saliva, when I start to get a jerk, won't make you get epilepsy. So viewers out there, epilepsy is not what? Contagious. So don't run away from somebody who's seizing. It's a big don't. Help them. Don't, this stigma that is around, this one has epilepsy, we have this, should go away. That's why we have this epilepsy awareness last week on the 2nd February of every year. The second week of February in every year, we celebrate the World Epilepsy Day. One of the goals is to bring out the awareness, tell people that epilepsy is not contagious. When I have epilepsy, I can live my normal life. I can control the seizures and I can become a doctor. I have doctors who are living with epilepsy and they are controlled and they're doing everything and they are helping.
They are doing their day-to-day.
They are doing their day-to-day life. The doctor with epilepsy is treating this person who doesn't have epilepsy, and they are doing very well. So those don'ts are very, very important. Please.
Thank you. Thank you very, very much, Dr. Sebunya, and thank you for coming to the Pediatric Voice and Bethany TV. Usually, you're very educative, and I'm very sure our public out there have learned a lot tonight because epilepsy is here with us. Just imagine, for every 6 children that are moving around, no, for every 1,000 children, 6 of them have epilepsy. And to make matters worse, 10%. In others, for every 10 children, 1 is likely to suffer a seizure in their lifetime. So seizures are here with us, and as you've heard very well from the experts, not all convulsions or seizures paramount to epilepsy, so be slow at calling your colleagues epileptic. Let's show love to others that are suffering epilepsy. It is like any other disease, and it can be controlled. And you know what, guess what, it can also be treatable, as you've had the new modalities like surgery that are coming up. In other words, if a lesion is removed from someone's brain, they can have, a complete cure of epilepsy. Don't cease your treatment without the help of a health worker, and please avoid putting the spoons, the forks in the baby's mouth when a child is having a seizure. And for those of you who have had your children have abnormal body movements, feel free to record the movements so that you have evidence to the health worker. It is easier for them to watch the video than for you to describe what you think you saw, because very often the mind is very interesting. You may describe what you feel you want to bring out to us, but when you show us the video, we can clearly see it and understand what is happening. That is it we had this week on the Pediatric Voice. I've been your host, Dr. Helen Namsoke. Till we meet next time.